Good afternoon. Today we're going to talk about a new product from Allergan called Voluma, really called Juvederm Voluma. So within the Juvederm family you have Ultra, Ultra Plus, and now Voluma, which are all hyaluronic acid fillers of different consistencies and therefore best used for different problems related to facial volume loss, with Ultra being used for the most superficial things, progressing through Voluma, which is really tailored towards deep volume replacement. Now remember that in the hyaluronic acid family of fillers, we're talking about a naturally occurring product. It's in your skin, it's in your joint fluid, it's a clear gel, produced in a laboratory, placed in a syringe, no allergy risk whatsoever, and no skin testing required to utilize it. So Voluma adds to the armamentarium of the Juvederm family of products to be used for general facial volume replacement. So what's really the sweet spot for Juvederm Voluma? It's FDA approved for placement into the cheek area for malar augmentation. It's really beneficial though as an off-label use for any area of the face that has deep tissue volume loss, which in my practice could include the temple, the brow, the cheek, the pre-jowl area, anywhere where you have deep tissue filling that could be replaced by either using this product, Radius as an alternative, autologous fat is an alternative, and Sculptra is an alternative. All of these areas where we're talking about deep volume folds that need to be replaced. So where does Voluma fit into this? Voluma is again an HA filler, which makes it very nice because it is an immediate effect like Radius, unlike Sculptra, which takes multiple injection sessions. It's very safe because it's an HA, so if you were to get a complication from it being an infection, which said is very, very rare, but just to bring up one for an example, you can inject an enzyme into it called hyaluronidase that will dissolve the product and resolve the infectious process, unlike something like Radius, which you can't reverse with hyaluronidase. So it's an immediate effect, it's reversible should you have one of those things that you don't really want to occur, a complication of some kind. And it has good longevity, so more longevity than what you would expect from Radius. Now, Allergan's done a study that showed 2-year longevity for Voluma. That study included approximately 4.5 syringes of filler per patient, however, so you have to take that with a little bit of cautiousness, understanding that if you only use one syringe, the longevity should perhaps be somewhat less than that. So for sure, Voluma is going to last you a year, maybe as long as 2 years. I personally tend to underestimate those things. I don't want to oversell anything. So perhaps a 2-year longevity, but certainly at least a year. Overall, Voluma is a great product for deep tissue filling. It's very safe, very low risk, reversible if anything were to happen that we wouldn't want to have happen, and it's a great product, very smooth for taking care of any of those deep tissue concerns that would be worried about in the aging process.